What are the best ways to sleep? Which side is best for you to lie on? Why? Over 20 years. That's how long we sleep in our lifetime. Have you ever thought about that? Questions then arise. Am I sleeping in the right position? Is it better to sleep on the right side? On the left side? Face down? On your back? That's what we'll discuss today. But that's not all we'll cover. We'll also talk about habits that affect your sleep. We'll discuss drinks and foods that worsen sleep. We'll cover natural sleep aids like melatonin and CBD. We'll also discuss clonazepam and other sleep meds and a supplement for anxiety and pain relief. So folks, let's start with a question. Are you really sleeping well? Hey folks, drop a comment or chat message. Let me know if you're sleeping well and where you're watching from, in Brazil or worldwide. I'll post the message in the chat, everyone. Where's everyone today? It's Saturday, 10 a.m. Tell me in the chat if you sleep well and where you're tuning in from. Guys, we spend a third of our lives sleeping, yet many don't know the right sleeping position. People also aren't aware of the pros and cons of different sleeping positions. This might seem trivial, but it's not. It greatly impacts your sleep quality. Let's discuss the most common sleeping positions. First is the prone position, lying on your stomach. When you sleep on your stomach, head turned to one side, your spine becomes misaligned. The normal curves of your spine can change when you sleep in this position. That's why it's common to get back pain after lying on your stomach for a while. Long term, this sleeping habit can lead to health issues. If you're concerned about how you age and worry about facial wrinkles, this position isn't the best choice. The pillow can create small folds and wrinkles that leave marks on your face. If it's a habit, these wrinkles may become permanent. So folks, sleeping on your stomach is the worst position. I'll share the best position, but first, let's look at other options. Our second position is sleeping on the right side. For spine health, right side sleeping is one of the best choices, especially if you put a pillow between your knees to properly align the lower part of the spine, which is our lumbar region. This position is more problematic for those with gastroesophageal reflux due to a muscle called the lower esophageal sphincter, which separates our esophagus from our stomach. And in reflux disease, this sphincter often doesn't function correctly. So what happens? This sphincter connecting the esophagus to the stomach allows stomach fluid to flow back into the esophagus, because at night, when you're lying down, gravity doesn't push bodily fluids downward, but towards where you're lying. If you're on your right side, gravity pushes fluids to your right. So stomach fluid can flow back to your mouth, causing burning in your esophagus and larynx. The next day, you'll cough with phlegm, have gum issues, mouth problems, and dental issues, and might wake up with an acidic burning sensation. If you have some of these signs and symptoms, if you have acid reflux, avoid sleeping on your right side, as it can worsen symptoms. The esophagus is a tube connecting the mouth to the stomach, positioned more to the right. If your lower esophageal sphincter isn't functioning properly, when you lie on your right side, stomach acid can flow towards the esophagus, making it easier for the acid to reach your mouth. So, sleeping on the right side often leads to more reflux. However, right side sleeping can help with snoring and back issues. Third position, everyone. Tell me, what position do you sleep in? Do you sleep on your stomach, right side, or left side? Do you sleep on your back? Let me know in the chat or comments. I'd love to learn more about you. So, the third position is sleeping on your back. From a spinal perspective, it's great, especially if we put a pillow under the knees to align the spine even more. Now pay attention. If you snore, have high blood pressure, are obese, overweight, or pregnant, this position isn't good for you. Obese people snore for various reasons. One reason is that the muscles in the back of the throat relax during sleep and fold backward, blocking airflow. This blockage produces the snoring sound. If snoring were the only issue, it wouldn't be so bad or terribly concerning. However, snoring in overweight people, especially those with severe obesity, is often part of obstructive sleep apnea syndrome. People with this condition snore and then briefly stop breathing for a few seconds. Carbon dioxide builds up in the blood, reactivating the respiratory center and causing the person to breathe again. So how does this happen? They snore, then stop. Snore, then stop. Have you lived with someone like this? While sleeping, they seem to run out of air. then suddenly snore loudly, as if gasping for breath. This cycle of snoring and stopping breathing causes micro-awakenings, releasing adrenaline to restart normal breathing. And what's the result? It raises blood pressure. Obstructive sleep apnea is a major threat to those with high blood pressure, causing treatment-resistant hypertension and increasing cardiovascular death risk. If you snore or are overweight, avoid sleeping on your back. The same applies if you're pregnant, as the baby in the womb presses on the inferior vena cava. That's why pregnant women are advised to sleep on their left side. Lastly, regarding sleeping on your back, studies show fibromyalgia patients feel better after adopting this habit. So it could be a good strategy for managing fibromyalgia pain. The fourth position, folks, is the best position. What's the fourth position? Sleeping on your left side. If you have reflux, sleeping on your left keeps stomach fluids away from your esophagus. Also, sleeping on your left side helps empty the stomach and improves bowel movements. If you snore, sleeping on either side can reduce snoring due to gravity, because the wall that used to fall back will now fall sideways, or it will relax much less. So the person won't have such an intense obstruction. Sleeping on your left side will also help your circulation, because if you're pregnant, overweight, or simply have poor leg circulation, your organs, when you sleep on your back, for example, can press on the inferior vena cava, as I mentioned, which is the vein responsible for bringing all the blood from the lower body, feet, and legs back to the heart. And since this vein is more to the right, that's exactly why we recommend pregnant women always lie down and sleep on their left side, because this allows blood to circulate more easily. With better blood flow, your heart works less and your circulation. This can even help reduce swelling in legs, feet, face, and more. So we've discussed the 4 sleeping positions. The left side is best, but how do you know what's right for you? Which position suits you best? We need to consider 3 factors. First is the spine. We need to align our spine. What are the best positions for spine alignment? Right side, left side, and on your back. But the best position is the one you find most comfortable. A tip for better spine alignment: place a pillow knees when sleeping on your side or under your knee. Got it? The second factor to consider after finding the best position is understanding if you have any health. If you have reflux, avoid sleeping on your right side. If you have back problems, avoid sleep on your stomach. If you snore or are overweight, avoid sleep. The third point is comfort. It's pointless to use the ideal position if it's not comfortable and prevents you from sleep. So the best position is the one that lets you sleep well. Okay, let's move on to the enemies of sleep. Drinks, foods, and activities throughout the day that can disrupt our sleep. But first, like this video, your thumbs up helps this content reach others. You can help someone else sleep better by doing. So if you want to help someone sleep better, if you want to improve someone's sleep, like this video, and they'll be forever grateful for the help and good you're doing for them. Let's talk about drinks. What beverages are enemies of our sleep? We always say water, lemon water, or apple cider vinegar. Why don't we suggest drinking water? Because it'll make you get up to pee multiple. So avoid large amounts of water close to bed. Besides water near bedtime, we need to be careful with coffee. Although it's anti-inflammatory and antioxidant, as much as it improves our mood, some people are what we call slow metabolizers. What does this mean? These folks, even if they drink coffee at 2 or 3 p.m., may still have their sleep affected by caffeine. Usually our body takes 4 hours to process coffee, but slow metabolizers can take up to 12 hours. So you need to listen to your body. I, Dr. João, personally don't do well with coffee, so I avoid drinking. The third drink, folks, is alcohol. Many people say they need a drink, a glass of wine, or a beer to sleep, and that's the biggest mistake you can make. Why? While alcohol might help you fall asleep faster, it'll disrupt your deep sleep. So you might doze off quicker, but you won't sleep properly. Your sleep will be shallow, leading to fatigue, muscle pain, and other issues linked to poor sleep quality. Besides drinks, we must consider sleep cycle. For good sleep, your daytime habits make all. Our brain needs to release melatonin to help. Melatonin is only released at change your life learn properly. You need to learn how to exercise effectively. And I teach you this in my book, The Longevity 100 Habits to Live Past. These habits will help